Now let's perform high-quality chest compressions. The first thing to understand is that this action is what keeps blood flowing to the brain and other vital organs during cardiac arrest. When compressions stop, even briefly, circulation drops dramatically, and it takes several compressions to restore it. That's why any interruption must be minimal and as short as possible. If a person isn't breathing normally or is only gasping and there is no pulse, we immediately begin CPR, starting with chest compressions. Position the person face up on a firm, flat surface. This could be the ground or a backboard, but never a soft surface like a bed. A firm base is essential to ensure compressions effectively push blood through the heart and body. When you're alone, the recommended compression-to-breath ratio is 30 compressions to 2 breaths, regardless of the victim's age. You need to compress at a rate of 100 to 120 compressions per minute. Remember this for the exam. That rhythm is consistent for everyone, 100 to 120 compression per minute. Depth is also critical. Compress the chest at least 2 inches deep, but no more than 2.4 inches. Most often, compressions are too shallow, so aim for firm, strong pushes, ideally with the help of a CPR feedback device if possible. As you noticed, in United States, we use as unit of length inches. Just to make clear, 2 inches is 5 centimeters and 2.4 inches is 6 centimeters. Another key part is allowing full chest recoil after each compression. This means you should lift your hands enough to let the chest fully rise again before pushing down. Incomplete recoil reduces the heart's ability to refill, which weakens circulation. Avoid interruptions and, if it is possible, make them less than 10 seconds. Give effective breaths and deliver each breath over 1 second. Avoid excessive ventilation, and chest compression and chest recoil depth should be the same. Remember this for the exam too. Let's go back to depth discussion. We already said for adults it should be 2 to 2.4 inches or 5 to 6 inches, and for children it should be at least 1/3 the depth of the chest, which is approximately 2 inches, 5 centimeters. And for infants, it is at least 1/3 the depth of the chest, which is approximately 1.5 inches, which is 4 centimeters. And one more time, we need to allow complete chest recoil, so we should not lean on the chest. And one more thing to add. This is for skill assessment test. If you're doing 30 compressions, it should not be less than 15 seconds and no more than 18 seconds. If you're doing 15 compressions, it should be not less than 7 seconds and not more than 9 seconds. Try to use stopwatch and imitate the compressions and see if you are in this limit. And high-quality CPR can be provided by bystanders or healthcare providers. If bystanders are not trained, they should try to do hands-only CPR, so no rescue breaths. If they can communicate with TCPR, they can guide them to do the 30 to 2 ratio. So during the compression, first kneel next to the person. Use your fingers to locate the end of the person's breastbone where the ribs come together. Breastbone, other name is sternum. Place 2 fingers at the tip of the breastbone. Place the heel of the other hand right above your fingers on the side closest to the person's face. Stake your other hand on top of the one that you just put in position. Lace the fingers of both hands together and raise your fingers so they do not touch the chest. Straighten your arms, lock your elbows, and center your shoulders directly over your hands. Use both hands to give chest compression, as shown in the image. And the other image is demonstrating how we need to allow chest recoil so the heart can be filled with blood. Additionally, other important term is CCF or chest compression fraction. This is the proportion of the time that rescuers perform chest compression during the CPR. A CCF of at least 60% increases the likelihood of rescue. So what this means, for example, our CPR was 10 minutes, and out of that 10 minutes, chest compressions were 8 minutes. So our CCF is 80%, and that is perfect. Now let's talk about infant chest compression, two-finger technique. First, we should place the infant on a firm, flat surface. We should place our two fingers in the center of the infant's chest, just below the nipple line, on the lower half of the breastbone. Do not press the tip of the breastbone. Give compressions at a rate of 100 to 120 per minute. Compress at least 1/3 the AP diameter of the infant's chest, approximately 1.5 inches or 4 centimeters. At the end of each compression, make sure you allow the chest to completely recoil or re-expand and do not lean on the chest. Chest compression and chest recoil time should be about equal. Minimize interruptions in compression, for example, to give breath to less than 10 seconds. After every 30 compression, open the airway with a head tilt chin lift and give 2 breaths, each over 1 second. The chest should rise with each breath. After about 5 cycles or 2 minutes of CPR, if you are alone and no one has activated the emergency response system, leave the infant or carry the infant with you and activate the emergency response system and get the AED. Continue compressions and breaths at a ratio of 30 compressions to 2 breaths. Use the AED as soon as it is possible. Continue until advanced life support providers take over or the infant begins to breathe, move, or otherwise react.